The United Nations International Children's Fund has concluded a 4-day outreach visit to different health centers and communities in the district of Moroto and Kaabong in Karamoja region. During the 4-day visit, UNICEF, among others, visited health centers and also engaged with communities on how to address the issue of malnutrition in the region. Although the cases of malnutrition have decreased this year as compared to last year, Kaabong district still tops on the list with high cases of malnutrition. During the malnutrition screening exercise held in Lomeris village in Kaabong, several children were found to be victims of malnutrition due to poor feeding.
Even if they decide to go far away to dig for maybe to get the foodstuffs and feed the children, the raiders will still chase them away from where they have gone to dig from.
Regina Auma, the acting in charge of Lomeris Health Center, says the center on several occasions gets overwhelmed by malnourished children. She says this is as a result of high poverty levels in the area.
The way I've said, still the level, people are poor. They don't have money to go and buy those foodstuffs to feed their children.
She has, however, appealed to government to prioritize fat-rich health centers in distributing drugs to minimize infant mortality rate.
Stock the health facilities with enough drugs so that the illnesses are well managed and it will not lead to malnutrition.
The UNICEF spokesperson, Catherine Ntabade, asserts that more engagements with the communities are needed to change their mindset, but also engage them in fruit growing to avert the issue of dieting. She says this should be coupled with funding of projects intended towards addressing malnutrition.
As UNICEF, together with the other UN agencies, we will continue to support this region. But we also note that if we bring in money, some of the problems will be solved. But there are problems where it requires a mindset of these people.
It's estimated that malnutrition is responsible for at least 4 out of 10 deaths of children below 5 years in Karamoja region. Dr. Ashraf Nalibe is the district health officer.
The issue of the insecurity, where most of the livelihoods, what was supporting the livelihoods of our people was raided or taken away. What I mean here is that most of our community were depending on their cows, on their goats, and this was taken away by the neighboring communities who are involved in the cattle rustling. So this leaves most of our communities impoverished.
The 4-day visit by UNICEF was intended to make comparison of cases of malnutrition and to find a way forward. Susan Naong and Andrew Sebira reporting for UBC TV.